Fellow Kenyans, we must speak truth to each other. Had we not taken the stringent measures that we did in March of 2020, the rate of infections in Kenya would have peaked to 800,000 people by July 30th of this year. And if, as we have seen is the case, that one infected person has the potential to infect 2 people, this number would have hit 2.4 million people in 21 days. By the end of August this year, had we not taken the actions that we have taken, approximately 75,000 Kenyans would have lost their lives from this virus. But because we took interventions early, we have recorded only 2,600 infections with 83 deaths. So therefore, fellow Kenyans, if this is the worst case scenario, we wanted to know what the other scenarios look like. So if today we put in place all the necessary interventions and relax these by only 20%, what would this look like? According to the experts behind me here, relaxing interventions by 20% would lead to 200,000 infections and 30,000 deaths by December of 2020. Further, if we relax the interventions by 40%, the infections will peak in November with 300,000 infections and 40,000 deaths. If we were to go even further and relax them by 60%, the pandemic will peak in October with 450,000 infections and 45,000 deaths. Although these projections are generated by a model, our experts have shown us hard evidence suggesting that countries which opened up without proper protocols also experienced serious waves or secondary waves of infections. Spike of infections were, for instance, experienced when religious gatherings were allowed in South Korea, Pakistan, and Malaysia. So if this is our new reality, and we face the dilemma of easing restrictions or continuing with them, the question then is, what must we do as a country? What is our irreducible minimum for reopening the country? What is the threshold below which we cannot go? Once again, according to the professionals with us here, the irreducible minimum for lifting restrictions has 3 thresholds. 1, to open up, the infections must be contained and the number of infections and deaths must be headed downwards. This is currently not the case in our country. 2, our healthcare system must be prepared sufficiently to take on a surge in infections. It must not be overwhelmed at any one point during this pandemic. Access to testing, isolation, and quarantine must be a bare minimum in our health facilities. This is not currently the case. 3, the capacity for surveillance and contact tracing must also be fully in place across the country. So the question then we must all ponder together, fellow Kenyans, is whether we have met this threshold or these three thresholds in order to lift the restrictions. Have the cases, as I have said, of infections taken a downward turn, for instance? The answer is definitely no. We are seeing an increase. Have we met the second minimum of prepared health systems with isolation? Again, as I said, the answer is no. And I just give two examples. Siaya County has only a 10-bed isolation facility, and already they have admitted 9 COVID patients from only one incident. Similarly, Busia County has a 34-bed isolation facility, and 2 days ago, that facility was full. So, fellow Kenyans, if there is a surge in infections in just these 2 counties, the healthcare system will most definitely be overwhelmed. So the hard question to pose here is whether Kenyans are prepared to nurse COVID-19 patients in their homes if our healthcare system cannot handle the numbers. Are they prepared to expose their children, to expose the elderly to COVID-19 patients in the close proximity of home? And yes, we have dispersed Kenya shillings 5 billion to the counties in order to assist them increase their healthcare capacity in view of this pandemic. But to build the necessary health infrastructure for such an undertaking requires time. We must get ahead of this pandemic by creating lead time. So therefore, fellow Kenyans, while considering the possibility of de-escalating the containment measures in place and conscious that health is a shared function between the national and county governments, I have convened today an extraordinary session of the National and County Government Coordinating Summit on Wednesday, the 10th day of June, to consider the following salient matters. First, to review the effectiveness of the containment measures we have taken so far, those that have been rolled out to break the chain of transmission of the coronavirus disease. The second, to secure the undertaking of every county government to deliver isolation facilities with at least a minimum of 300 beds. And thirdly, within 14 days, to develop time-bound protocols for progressive reopening of the economy.